The Ekiti State Commissioner for Health, Dr. Oyebanji Filani, joins us now via Zoom. Welcome to the program. Let's begin. The Ekiti State Ministry of Health, you've recently directed that all medical facilities, government and private, conduct COVID-19 tests on any patient with cough, cold, fever-related symptoms before treatment. Now, is that working or being adhered to, and will it continue with the arrival of the vaccine?
Well, first and foremost, thank you for having me on the show, and I've quite enjoyed your coverage of the COVID-19 vaccine across the states. Earlier this year, at the beginning of the year, we made the decision to ensure that everybody who meets the case definition for COVID is tested, whether in a private sector facility or even in the public sector facility. And this was important because we wanted to be sure that people were not treating malaria wrongly, whereas patients probably had COVID. I think that has worked very well. Between January and now, we've tested just about 90% of our total testing that we did between March 2020 and December 2020. What that means is that we've aggressively scaled up our testing capacity because we have more facilities who are testing. And the idea behind that is to ensure that we can catch it very early, identify and diagnose it very early, and ensure that people are able to receive adequate care. In Ekiti, the testing and also the treatment has always been free, and we have to appreciate His Excellency for that. With respect to the question around will that continue, most certainly, the vaccines have come. It will take some time to ensure that we get it to everybody because of the limited doses that have come in the first instance. But we would maximize this current dose across our healthcare workers and ensure that we have our strategic leaders and our frontline workers across the state are able to receive these vaccines. Thank you.
Finally, some religious institutions and other groups appear to be opposed to receiving the vaccines. What are the plans to reaching out to them?
So I think the first thing to say here is that, and it's perhaps it's still anecdotal, but the impression we have, or the sort of like warm reception we have within Ekiti to receiving the vaccine in the last 24 hours has been really great. And we would hope that we can build on that momentum. Just last week, I'd spoken to a couple of our religious leaders on multiple sides, the Christians and the Muslims, and they've all indicated, the ones I've spoken to so far have indicated their interest, not just to collect it, but also to show it publicly. We recognize that, there are different stakeholders, and the religious leaders are such an important stakeholders. If they do come out and take these vaccines publicly, we believe that would have a lot more people who feel more comfortable and confident. That said, that we've reached out to 1 or 2 or 3 or 4 does not mean that we will not continue to do that. People who have genuine concerns will continue to engage with them, and we hope that we can bring even more people into the fold.
All right, we'll continue to watch the developments. We'd like to thank you, Commissioner for Health, Ekiti State, Dr. Oyebanji Filani. Thank you for joining us on the program.
Thank you for having me.